All right, so thoracic spine passive range holds. What you'll need is a yoga mat and some sort of marker. I like to use a Element packet or a Correct packet, whatever this may be. Something that's small that can fit underneath your chest and kind of give you some feedback. And it doesn't necessarily have to fit under your chest, but something smaller that won't roll on you would be more ideal. That'll come to play in a minute. So, I'm going to set up. I'm going to show you how to do a passive range hold. I'm going to show you how most people cue thoracic range holds, and then how we can level it up so that we're working the entire thoracic spine instead of just one spot on the upper back. So, prone position, right? So we're here. We press up into up dog, right? As most of us know. And this is putting our upper back, our thoracic spine, and the paraspinal muscles into a passive end range, right? And then what we do is we bend our elbows, slowly lowering ourselves down. And as we lower ourselves down, we engage the musculature in the upper back along the spine into thoracic extension, right? And we squeeze our muscles in thoracic extension. And as we lower down, eventually the weight in our hands should get lighter as we squeeze the musculature in our upper back, meaning we can hold ourselves somewhere to where we can gently pull our hands off the ground and hold in what's our most active range of motion, our furthest active range of motion in thoracic extension. Once you have that, you hold 5, 4, 3, 2, 1. Slowly, with control, parachute down, press up, back into your passive end range, squeeze the muscles in your upper back, squeeze, if you've warmed up properly, hopefully, right, as hard as you can, squeeze until you reach your active end range, which for me is about here. 5, 4, 3, 2, 1. Slowly lower down. That's rep 2, right? For some people who have never done anything like this, you don't have to look like me. You're where you're at, whatever that may look like. For you, it may be all the way down here before you can confidently lift your hands off the ground, squeezing as hard as you can. 5, 4, 3, 2, 1, and coming on down. Now, if we let go too early, say, our active end range is here, and we let go here because for whatever reason we think we want to, what can happen with the body is that we fall into our actual active end range, right? Feet come up, we rock forward. We don't want that. We want full control here. Squeeze, squeeze, squeeze. I can lift my hands here. 5, 4, 3, 2, 1. Come on down. Now, the reason for the packet is that if I continue to do passive range hold, squeeze here, it may feel as though I'm working all of my musculature along the thoracic spine over and over, when in reality, if I'm able to stop here, the apex of where my body is still in contact with the mat and the opposite of where that musculature lies on the back, that's what's being squeezed most to keep me up here. If I want to work further up the spine, which is what we want to do, we want to work all the musculature up each segment, right? Which would be a lot, but if say we're doing 3 sets, what we'll want to do is, for me, if it's here, I want to think, okay, if I'm doing a passive range hold here, I want to go about 2 to 4, depending how much length you have, 2 to 4 finger lengths up. Place your marker there. So for me, it's about here, right below the sternum. So next time I do my next, not set, but my next, not rep, but my next set, so set 2, I'm coming down. This is rep 1 of set 2, 5, coming down, coming down, coming down. Engage. I can hold myself way past this point, but once my chest hits that marker, now I'm squeezing, 5, 4, 3, 2, 1, coming on down, coming up, past the marker, squeezing. I can easily hold myself here, but I want to find and slowly articulate down, down, down until I hit that marker. squeeze, 5, 4, 3, 2, 1, coming on down. Set 3, bring it up a few inches, right? So now this is like an inch up my sternum. I'm coming up passively, squeezing, coming down passively, not just flopping forward as one unit, but trying to come down one segment at a time. I'm in contact with that marker, squeezing up, 5, 4, 3, 2, 1, slowly lowering down. Now, the further you work your way up the thoracic spine for the passive range hold, again, you're working the musculature differently. It's going to get much harder as you go up. So if you're just starting out with this and you want to just learn any sort of engagement at the upper back, if you're really missing active thoracic extension and you can't get past, can't get past your sternum and you just want to work there for now, great. If you want to challenge yourself, find out exactly where your active end range is. Come down a little bit, place the marker there, go past the marker passively, squeeze, squeeze, squeeze. Know that you can hold here, but we're going to come down, continue until we hit that marker. Squeeze as hard as we can once we hit that marker, which is going to be, again, much harder. Hold, 5, 4, 3, 2, 1, come on down.